Um, and let's give a moment for people to join, and then we can get started on one.
Welcome to today's Link Senior webinar, everyone. We'll get started shortly. Good afternoon and welcome to today's Link Senior webinar. Today we are providing one free NAB and an NCCDP CEU credit. In order to be eligible for the CEU credit, you need to remain on this webinar for the full hour. At the end of the webinar, I will provide the required post-webinar CEU survey link in the webinar room chat box, and we'll also send it by email this afternoon. Please check your email spam folder. If you don't receive the link this afternoon, do email me right away so I can send it to you directly. If you have questions about our CEU process, please read our new FAQ page on our website, which I will paste in the chat box now. And remember that CEU certificates will be issued by email on Friday, January 8th this week. Again, please be sure to check the spam folder that day. With that, I'm going to hand it over to Charles D. Villemorn, CEO and co-founder of Link Senior. Charles?
Thanks, Megan. Hi, everyone. Welcome. Happy New Year 2021. I think we've long waited for this year to come, and for me and the rest of my team, and I'm sure Josh, I want to extend a sincere thank you for the work that activity and life enrichment professionals have done in 2020, and wish you, as much as everything that you deserve for 2021. Josh and I are going to be leading a super exciting webinar today. We decided to change things up a little bit and improve them. And today we're going to be focusing on COVID-19 and the state of resident engagement in 2021. So obviously, we've done these state of resident engagement in the past years, but given the impact of COVID last year, we had to change it a little bit and obviously take that into account. Now, the improvements also that are coming this year is the fact that we have built this very successful platform called Activity Strong to acknowledge, empower, and educate activity and life enrichment directors. And you probably noticed, if you were on one of our December webinars, this is an executive edition. And it is very exciting for us as we build the future of activities and resident engagement. And to do this, we want to have a all-inclusive discussion, especially with thought leaders, C-level leaders in the industry. This is why we've created this executive edition. The idea is that everyone is welcome, but if we as activity directors want to have a conversation with our administrators or executive directors, we need to invite them to the discussion. So let me pause here and say that if you are a C-level leader in the industry, if you are an administrator and executive directors, I want to personally thank you for taking the time and attending today's webinar, because it shows your commitment to resident engagement and understanding that purpose is a basic human right for our residents. And if you think that your administrator or executive director is not on this webinar and should attend this webinar, please feel free to invite them. We will be holding these every month, every 4 weeks, once a month. And the upcoming schedule is on our website, and we will be sharing that a little bit at the end of the webinar. So without further ado, for people that don't know me, I'm the CEO and co-founder of Link Senior. I believe that our industry is activity strong, and I love and respect dearly activity directors and life enrichment directors. I was very lucky when I started in senior. Somebody recommended that I certify myself as an activity director, and that was now almost 13 years ago. Joining me today is Josh Crisp. He is the CEO and founder of Solinity, and Solinity is a partner through Bridge the Gap, is a media partner of this executive edition. And Josh and I were thinking of partnering today to make this conversation interactive as possible. You know, I'll let you read Josh's description and Josh's bio, and Josh is going to introduce himself shortly. But I want to share with the audience today that I had the pleasure to meet Josh probably 10 years ago at a NAP conference in Tennessee. And, you know, Josh, I remember that meeting very well. You were, I think, representing a provider then. And I'd love you to introduce yourself and say, you know, what you've been up to in the past 10 years and your commitment to the activities world as well.
Well, thank you, Charles. It's an honor to be with you. And yes, it was about 10 years ago that we met at an activity professionals meeting, and wow, that it's hard to believe that much time's passed. This is about my 15th year in the business of taking care of older adults that we call senior living. So developing, owning, and operating. When I met you, Charles, at that conference, I was managing as an administrator a community in Tennessee and had just become a regional director of operations. And my world was kind of open to this world of activity professionals. In senior living, I had been searching for resources for what I felt like was a very underserved group of activity professionals. And I came across that organization and met you, and it's been a wild ride ever since.
Thanks, Josh. Just as a quick note, we've had a few comments in the chat saying that if you could turn up your mic, that would be great. But cool. So just for a little bit of background into today's presentation, just before we start the actual presentation, you know, we at Link Senior started Activity Strong, as I mentioned, to represent, advocate, and empower activity directors and life enrichment professionals. We were also the organization behind the Old People Are Cool campaign that started 5 years ago. And Josh, I know that through your different organization, we partner a lot on that, especially your Pedal for Alzheimer events and so on. But you know, Link Senior, just for a quick introduction, we are a evidence-based resident engagement platform for senior living. We've been serving the industry now for 13 years. And what we do is we help activity and life enrichment director amplify the work they do by helping them ultimately measure and optimize and manage resident engagement. So we are the only platform that can say that we are evidence-based because we published a study where we saw amazing outcomes in a peer-reviewed journal in September 2019. So these outcomes that you're seeing on this slide here are things that are the results of the implementation of a tool like Link Senior. And obviously in this time of COVID, anything related to social engagement is something that everybody is seeking. So if you're interested in that, please be in touch. But without further ado, let me get into the meat of these webinars. We started these webinars now 3 years ago. And it all stemmed from what we understood as a need for activity and life enrichment professional, which was easy access to quality education. And believe it or not, and I'm sure it's still the case today, also the fact that some of our professionals couldn't leave their communities or buildings. So we thought about doing these monthly webinars, and then when COVID hit, March 2020, we transformed this into the Activity Strong platform. I think one of the reasons for the success of these webinars is the fact that you, the audience, have helped us understand, you know, what you want to hear from, you know, who are the leaders in the industry. So please, If you have any ideas, or if you believe we should highlight somebody, please reach out. The email is on this slide, and we will do our best to consider this and invite that potential speaker. So with that, let me get into today's presentation. And the first thing I want to do is make an announcement, which is with our different partners with Activity Strong, which includes Josh's organization, Bridge the Gap. We are very, very happy to release our 2021, the Year of Resident Engagement, the Activity Strong Executive Edition white paper. We have put a lot of work understanding three things. One, what was the impact of COVID-19 on resident engagement? The second thing is, as of today, which is January, where is the state of things, right? What is the industry going through? And three, based on what we know, what we understand, what are the current trends? So throughout the webinar today and with Josh, what I'm going to do is highlight some pieces of that webinar, of that white paper, And Megan just pasted the link to the white paper in the chat. I recommend that you all download it and maybe consider looking at it as we talk about it. So with that, let's get into it. And the way I'm going to do this, just so that everybody knows, this is the white paper itself. It is free for everyone to download. Please consider it as a resource for you to use as a professional, as a department, and as an organization. So without further ado, let's get started. Josh, are you ready?
I'm ready. Let's rock.
Cool. Okay, so it's so basically what we're going to go through is three big questions, right? Like what just happened to us, right? I think we're still trying to understand what just happened to us, all of us, right? Like every human being on the planet. The second thing is where are we now? And then three, how do we kind of go from here? What are the trends? What are the predictions in 2021? And so with that, Josh, I forgot to ask you in your bio, but what is your wish for the industry for 2021?
Oh, wow. Such a big question. So I'll tell you, Charles, and I don't want to be long-winded, but this past year has cast a huge spotlight on our industry, and sometimes not for the best of reasons. I'm hopeful that we can take that spotlight and reflect back to everyone what an awesome industry that we have and what an awesome job that people like, I'm sure the hundreds of people that are on with us right now, what a great job they were doing prior to 2020 and what a great job they do on a daily basis. I hope that we can all find a way to take maybe some of these negative experiences and fuel that into positive change. And one of the things, Charles, I think is I, as an operator, as an administrator, as a manager, have often felt, and we've had these discussions, that our activity professionals and the budgets that they have and the things that they represent and the projects that they do are often just not given enough attention. And wow, did 2020 shine a light on activity professionals. So I'm hoping that with that light, we can spread and actually show the value that we know that this is to the communities and make some great improvements.
Yeah, and I'm sure that the audience very much believe the same thing or feel the same way, which is a great way. Thanks, Josh. Which is a great way to get us into our first question, right? So for each of these sections, 1, 2, 3, we're going to have a question for you, the audience, and please have your response in the chat, and we'll do our best to pick up the comments and make it a conversation. But what we were thinking about is, if we reflect back to 2020, as Josh was saying, historically, activities and life enrichment have never been truly respected for the value that the professional brings, right? And 2020, in a way, there's been a lot of challenges, but there's also been a lot of potential, like Josh was saying, kind of shining the light on these professionals. And as I do these meditation classes, and sometimes the instructor reminds us of this thing about meditation, which is you shouldn't try to figure out what meditation is doing to you when you do it. I think what's important is to think about what happens the day when you don't do it, right? And I think the question we were thinking about asking you, the audience, is take a second now, just now, take a second and think about 2020 and imagine 2020 without resident engagement, right? Imagine the senior living industry going through this COVID-19 pandemic without activities, life enrichment, and so on and so on, right? Like, what would it have been, right? And I think this is a great way for us to consider the value that we bring, right? Our elders would have died of loneliness and boredom. Thank you, Kate. I can't agree more, right? Like, purpose is what drives us every day. Purpose is what helps us get up in the morning. And loneliness or boredom are, two of the three plagues of the nursing home. The older paradigm. Josh, what else are you seeing here?
So the chat is lighting up, Charles. So this is fantastic to be able to see this. But my favorite comment so far is we would be like cavemen. So that one almost made me chuckle.
Oh, wow.
But I agree. The isolation, which we know and studies are showing us how much isolation is so unhealthy. And thank you for pointing that out in your white paper, Charles. By the way, brilliant job. I got to read that just in the last 24 hours that you sent that to me. But the health effects, I think we're still learning, and that is unbelievable how detrimental it can be to our health. So, so thankful again for the activity professionals that are out there combating that.
Yeah, you're right. Actually, I'm trying to follow the chat as well. It's amazing. So we had somebody just say something like increase in dementia. We are dead in the water like a boat without an engine. All of these comments are true. One thing that we're still considering, and we don't know the impact yet, Josh, but I don't know if you know this. When we have, unfortunately, older adults passing away in our communities, on the death certificate, we can have something called failure to thrive, right? There's this concept that if you don't have purpose every day, there could be a medical diagnosis, which is this idea of failing to thrive. And I'm actually writing, we're writing on with a project with Penny Cook of the Pioneer Network about putting out a blog post on the topic. But there's something inherently super important is that, and I can actually jump 2 slides here because it's a great way to get into that. We know that finding purpose is a basic human right. Like, every human being, regardless of age, needs to find purpose, needs to have a reason to get up in the morning. And we know that without activities, without life enrichment, there is, for a lot of our residents, no purpose because they need our help. They need to collaborate with us to get to that. And there's some kind of fear in the industry that we might see more of these diagnoses, right? But this is all the kind of negative part, right? Like all the things that we know would have been sad and so on. But there's also been a lot of very positive things that we've been seeing. And Josh, I don't know if you have things that you're proud of. Well, actually, let me ask you the question. What are you the most proud of our industry from last year? What's the one moment where you saw your industry and you were saying like, oh, wow, I'm proud of what we do here?
Well, thank you for asking that question, because for me, in people and teams, true character shows is in the difficult times. And
Sure.
I've had the privilege with my co-host, Lucas, as many probably know if you listen to our show, we get the opportunity to talk to a lot of leaders, a lot of professionals, a lot of thought leaders. And there's been a consistent theme that we've seen and that we've heard through this year, and it's people rising above the circumstances and going above and beyond. And I think even your study pointed this out, Charles, that even our activity professionals and the executives that are on the phone and on the line and on the Zoom with us today, many have kind of inherently taken upon themselves tasks way above and beyond their job duties. One of the positive things, and I hope this carries forward, is, to me, I always have felt that in our industry, we get very much in silos among different care types and acuity types and among our departments. So our care departments, our clinical and our life enrichment and activities and our operations. And one thing that I saw this year is that we just broke down a lot of those barriers and we pulled together for the best of the resident because we had to. So I would love for those barriers to stay lowered and not build up those silos again. And I think that's one possible opportunity that we have to build upon.
Yeah, and Rebecca also mentioned in the chat the idea of teamwork. And I think, for sometimes for different reasons, we've seen in all of that. But the one thing that we do know, and we have, I think it is part of the white paper. Actually, let me show it here. One of the things that we do know about teamwork is that we didn't really have the choice, actually, because if you look at the page number 3 of a white paper, what we've done is that we've done the analysis to try to see, if we were to do the same quality of engagement pre-COVID, what would need to happen? And we know there's been a huge strain, a huge pressure on staffing because we don't have help from the outside, or we're limited, right? Because our communities are still somewhat closed or completely clogged down. We can't really do groups because of physical distancing measures, and we simply have less time, right? We're pulled in different directions. And one of the big impacts is the fact that, for example, in assisted living, if we wanted to do the same type of quality as before, we need to go and find 224 hours a month, right? And as far as we're concerned, we don't see many communities hiring right now, probably not until Q2, when there's some kind of vaccination and we see census building up again. And the reason why I'm explaining all of that is that this idea of teamwork is the only way we can get out of this, right? Which is to have help from other departments and bring this idea of interdisciplinary work. And Josh, what you just mentioned about the silos, this is, I really, really hope as well, this is I hope one of the big lessons we're going to learn is that we are all in this together, and together being all the team members, all the departments, and we will get through this and beyond all together.
Oh, you're exactly right, Charles. So I asked the question in the chat. And by the way, again, I just love the chat. Thank you all for engaging like this. I think it helps us to all feel more connected, even though this is very virtual. But I am seeing all kinds of things, everything from tech assistance to CNA type care duties that they were allowed to do, to helping in dining services. Honestly, those are all great burdens that people have taken on. And the other question I asked that I would love that you were just touching on is this idea of the interdisciplinary team. That's not a new concept, but I'm hopeful that becomes a much more prominent concept, and that life enrichment is a part of every interdisciplinary team that is out there and has just as equal of a voice.
Yeah. And then somebody else was talking about the fact, the idea of flexibility. One thing that, we've been in a bad way, right? We've been forced to change and adapt and be flexible. But I think that as we did that, we realized two things. One, sometimes it doesn't really make sense for us to plan ahead 45 or 60 days ahead. Like, who knows what's going to happen in 60 days, right? So this idea of having an activity calendar right now, planning 45 days ahead, that's kind of, like none of us outside of senior living plans your days. I mean, Josh, I don't think you're planning your personal events 45. I mean, maybe you are, but like not 4 days, right? So I think that's one kind of good lesson learned. And I think the other good lesson learned around flexibility is that we're kind of more connected to the residents, right? We're probably less connected because we don't have time and the resources, but when we are, we're probably more focused on the quality interactions. And I think this has been, throughout this year, well, I keep on saying this year, throughout 2020, it's been one of the big comments we've heard from professionals, which is how much they enjoy and how much residents have been enjoying this kind of this much higher quality engagement.
I don't want to open up too much of a can of worms here, Charles, and take us off course, but I'm just wondering too, one of my hopes for this year and the coming years is back to my original comment, and it's that we can realize that life engagement of our residents is really everyone's responsibility, right? It's not just the person that gets paid to do that. Just like anyone participating in any other aspect of resident care. Resident engagement is part of the resident's care. It's part of us providing them purpose, and actually maybe not even providing them purpose, but reminding them that they already have purpose. We don't necessarily give them their purpose, but we remind them and encourage them along their way. And so I'm hopeful that this spotlight that is on us can radically change and realign things. From the stakeholders, you have to realize in many times the business, I use that in quotations, the business of healthcare and our building our budgets oftentimes is not allocated appropriately. And so I think one of the things that has gone way upstream, and I'm hearing the REITs talk about it, and the owners and the people that own the real estate, is now that this spotlight that often has been negative on our industry over this past year, they're actually saying, you know what, we've got to put more energy into this. We've got to work together for this problem because the problem has been spotlighted. So I do think we're going to come out of this much stronger.
Yeah, thanks for it's getting it out of this stronger. One thing that has been amazing is throughout 2020 is the optimism and the resiliency of the staff, right? Like when we asked a simple question over the summer last year, we asked, do you believe that we'll get out of this stronger? And I think it was an astounding 92% of staff that said yes, right? So that speaks to that. Now, I just want to go back to one of your comments, Josh, which is I do want to mention how cool it is to hear you say it, which is that we're not here to give them purpose, right? We're here to either help them stay connected to purpose. Sometimes, we all need help, or remind them. And I think it's so important, like you said, Josh, it's not us telling them what to do. It is us having a conversation with them, regardless of what the interest is, where they are physically and cognitively, and us assisting them. And well, I don't really like the word assisting just purely, but collaborating and working with them so that it happens, right?
100%. I believe firmly, and I've witnessed this, and I know the professionals on this have as well, that when you remind and you enable and you empower an individual to live their purpose, remind them of their purpose that they have within them, regardless of their frailty, regardless of their disability, if they're living, if they're breathing, if they're on this earth, they have a purpose. And you're exactly right. That's our job, to remind them of that and to help them with that.
Yeah. So, you obviously touched upon a very interesting topic, which is this idea of budget, right? Like you said, I think the word budget at least 2 or 3 times already. But this is something kind of dear to all of us, which is, is the importance of our work represented from a quote unquote business or budget standpoint? And I think the answer to that is probably not most of the time. And if I'm an activity director today, Josh, and I walk to you, the administrator or executive director, and I ask you, Josh, please double my budget, right? The answer is really, is often going to be no. And based on my experience, our experience, and I'd love to get your viewpoint on this, Josh, it's not really your fault as the administrator, right? It's sometimes also kind of this teamwork not happening of me, the engagement professionals, not really explaining why, and it's sometimes a little bit about you also, the administrator, not working collaboratively with the department. And I know there's a lot of tension on that. I don't want to get into kind of the political aspect or so on and so on. But what do you see happening there? What are the improvements? What are the best practices? I'd love to hear your thoughts on that particular topic.
Well, I have long said, and I've been in for many years in the tough position of even making the budgets, and it's always so difficult because you always feel like every department needs more than what we're able to allocate to them. But it would be hands down any budget that I've ever been part of managing. I would say if I could point to a department, so to speak, if I could refer to it as a department in a budget, that area always seems the most underserved. With the least amount, it's the first to typically get cut. And it's relying so much on volunteer help as well. That's one of our areas that relies more on volunteers. And so if you took away the volunteers and you took away also those added family visits and things like that we've been limited to, what a wake-up call it is to administrators to see when the spotlight is on it. And we know how important it is now, and the world outside of our community knows how important it is. What a depth that we've been operating. I think it shows us a couple of things. I think it shows us the commitment, because I think our professionals have been doing an amazing job prior to 2020 and during 2020 with very little resources. So I do think it's going to, there is no silver bullet because there's only so much money in a budget. And if you start pulling from other departments, what are going to be the deficits there? I think the real key is approaching it from an interdisciplinary, from a team approach, and saying, how can this team, yes, we've all got our primary assignments, but our common goal in providing quality care is on helping our resident live their purpose to whatever level that is for them. That is a integral part of quality care, physically, emotionally, spiritually. So we have to incorporate that into the care model. And I think when we begin to think that way, when we have our interdisciplinary planning, when we have our interdisciplinary budget meetings, if we start coming at it from that angle, I think that's when we start seeing positive change.
I don't know if you're tracking the chat, Josh, but it's pretty amazing. One of the comments, amazing comments within this, right? One of the many amazing comments really speaks very well to what you just said, and that is from Jennifer Stones, who was saying that developing a budget is about values, right? What you value is where you put your money. And Jennifer, I just want you to hear this from me, and obviously I'm sure from Josh, you're 100% honest. And I think that we as a professional, we can help our organization by helping connecting activities to the values, and therefore helping the money flow that way as well. And Josh, your point about interdisciplinary, goes back to what we were saying about teamwork and so on. So 100%. I think this is a great segue for us to get into the second question we had, which again, if you have downloaded the white paper, you'll be able to follow it here. But essentially, as we as we try and understand where we now, and obviously given the free flow of this conversation, we've kind of addressed some of it right now already. But, we have a question for you, the audience, which is, what is blocking you right now, right? We've gone through 2020, we're all alive. Thank you. We've all gone through a lot of losses. That includes death. I think we have to talk about the many losses we've all had. But I think that as we look in 2021 is going to be better than 2020, right? It's very difficult to make something worse than what we had in 2020. So when we think about it that way, and when we think about what is blocking us, right, we have to then think about how do we overcome this, right? Jennifer's point about budget is absolutely correct. When value is found, budget is found, right? And when value is articulated, then we can articulate a budget. So how do we get into that discussion, right? How do we enable us to have these discussions with our teams and overcome things that are blocking us? Josh, I'd love to hear your thoughts on this.
Well, I think it initially starts with some planning, some intentional planning. I think we oftentimes, and when I say we, I'm including myself in that. So I think we get so caught up in responding and reacting to everything that's happening. This past year, it seemed like as soon as you learned what you should be doing, you were being told what else you needed to be doing that may have been different than what you just told your team that you needed to be doing. So there was this constant, urgency of change. And so there's a certain level of flexibility and adaptability that we have to be successful and to begin to think about overcoming obstacles. But I think also taking time to have very intentional plan sessions to plan for the unexpected, right? If 2020 has taught us anything, it's to plan for those things that you could never imagine, right? And not that you need to be planning for every possible scenario, but how is the team going to respond together to overcome the obstacle? Just remember, your obstacle is you're not facing that hopefully alone. And if you are, I think part of this and what I want to communicate today is we are in this together. You're in this with other team members in your community. And I think there was about 900 professionals that organized on this call or more today, Charles, which was phenomenal. And the community that you have built, and even what I'm learning through this chat right now, those are the kind of things of working together that we begin to have the conversation of how we overcome the obstacles. I'll say 2020, I don't think it could, we hope it could never get worse than 2020. But I guarantee you, if we live on this earth long enough, there's going to be some obstacle that hits our industry that we think, oh my gosh, here we go again. So I think the team approach is the way to go.
Thanks. What you just mentioned about the idea of planning is extremely important. The challenges of 2020 had a lot to do about the fact that we were used to working that way. Every month we would consider next month as another variation, hopefully for the best of us, and for many of us probably an improvement of the next month. But we still operated within a certain framework. And when you consider the changes, the pressure with COVID-19 and the pandemic and the way we've completely had to rework activities, like our discipline has been disrupted and still is, right? We're still learning, for a lot of us, still learning every day how we can be more flexible. I think the other thing also is what is blocking us right now. We had, I think, a couple comments here have to do about team morale, right? Like the ability for us as an individual and as a department to take care of ourselves. And I think that, beyond senior living, I think that our whole planet Earth is going through some kind of mental health issue because of COVID. And I think it's important to also pause and reflect about that and learn how can we individually take care of ourselves and look out for our team members, look out for our department, look out for other team members. And obviously it's this idea ultimately of the oxygen mask, right? Like if the plane has an accident of some sort, like the instruction is that you need to put on your own oxygen mask before taking care of somebody else. What do you see, Josh, in terms of self-care, mental health, all of that in the industry?
Well, I think we don't do a good job of taking care of ourselves. I also think, generally speaking, as an industry, as an executive in the industry and building and managing a lot of teams, we don't do a great job of caring for our teams. To your point, Charles, and it's something that I've taken a mind shift myself in our emphasis that early on in my career, all of my emphasis I felt like was on caring for the resident physically, emotionally, and spiritually. And I very much unintentionally overlooked my staff, and I was not caring for them physically, emotionally, and spiritually, so that out of that abundance of them feeling loved and cared for, that the team members and then the residents could feel cared for. So I think that's one issue there. I want to reference back a book that I read early on in my career. It's very old. It's called GMP, The Greatest Management Principle. And the whole book talks about personal accountability. And 2020 should teach us that a lot of bad things can happen around us that we had nothing to do with. We can't take responsibility. They are things that have happened that are impacting us. And in those kind of situations, it's extremely important for us to think about, we can't determine a lot of the things that happen around us, but one thing we can always determine is how we respond to them. So I think that is one thing in overcoming obstacles. It's very easy for us to get so fixated on the problem that we don't positively think about potential solutions. And so I would encourage every single, I'm going to refer to them as light, every single one of the lights that is on attendance today, that little light that you have of positivity, the brighter you can make that shine, the easier the obstacles are going to be to overcome, because it is contagious. And in dark times, that's when it really shines.
Amen. I love this. I don't know if you probably heard that, Josh, but when I remember very well back in March or April last year, we had so many professionals hearing that they were not essential, right? And how untrue that is, right? That activity and life enrichment professionals could even be considered as non-essential. We argue, and I think everybody on the line would as well, that activity and life enrichment professionals were and still are the lifeline of our industry, right? More than essential, this idea of protecting this basic human right of finding purpose every day, I think this is probably the most important thing that we could do right now, is consider how important the work is. And I had a slide on this, but I'll get directly to this, which is, one way I know a lot of professionals had been able to, continue to show up at work, thing for which I'm actually so thankful for all of you for making that commitment for older adults. But a lot of professionals have been able to do it just by thinking back at what is their passion, right? What we know when we work in activities and life enrichment is we know our passion is about collaborating, right? So collaborating is, back to your comment, Josh, actually, not assisting, not giving, collaborating with the residents to help them, to honor their preferences, right? To help them find and have access to their purpose, or just be reminded of what it is. And for a lot of professionals, it's been kind of this guiding light, right? This North Star as we've been going through these challenges. I can't stress how important the work of activity and life enrichment has been and continues to be. And I just said it now, but I want to say it again. I am so thankful to be able to work with professionals like you. I made a comment back last summer, but I'll do it again here, which is the work that you do, the audience, right? Like your commitment and showing up every day at work. I have 4 kids, and if they were able to do half of this in terms of heroic work, I would be a proud father, right? So, and it's true, like I really respect that every day these professionals have decided to show up at work. Josh, I don't know if you have any thoughts on this, but I know you're a father too. So, yeah.
Well, absolutely. And, as we talk about helping our residents, reminding our residents, collaborating with the residents to live their purpose, it's very important that we all are reminded that we have a purpose as well. So it's not just a job. Any job in senior care and housing, especially that of an activity professional, I personally view it as it's kind of a calling, and I refer to it as that as when people are looking in this industry, it's really a calling. It's not going to be the sexiest job, it's not going to be the highest paying job, but there are some people and industries in our culture today. I immediately think of people like our teachers and other heroes that we've talked about and the frontline workers. But I put life enrichment and executives in senior housing right up there with that. It is a calling and we have a purpose. And I think one of the things it's okay that I've learned this year, it's okay to be transparent and with the residents that are going through tough times. One of the greatest things that we can do, especially in that one-to-one care situation or engagement situation, and it shows great empathy, is to meet them right where they are. Because I guarantee you, just like your residents are getting hit from isolation, all of us to a certain degree have had some isolation as well. So we can be empathetic to that, and we can be honest with our residents and share that. So I think we have to remember to live our purpose as well.
That's a very cool concept, Josh. It goes back really very well in this idea of self-care. And I think that's something that you just hit, I think, on is I think we should all remember that COVID-19 is affecting all of us, and all of us with a big A. It is impacting every piece of a society. And we just happen to be in probably the industry that is impacted the most with education. So I think it's important to remind that and to understand, because that's how we navigate out of it. I had prepared a quick slide about where we are related to the cases and so on. In the interest of time, I don't think we can really discuss that. But Josh, I know that, our industry is going through this vaccination process. The rates are what it is. What do you see? What are your thoughts in the next, 1 or 2 quarters?
Well, Charles, that's a big question. I will say this year, outside of just my own, I'll take my personal, what I see, and I'll tell you what I hear. And I'll tell you, I hear very mixed ideas on where we are, where we're going. But one common theme I have heard resounding that it's a very positive outlook ahead. I think timing, everybody's a little bit different of how quickly we're going to come out of, how quickly the vaccine is distributed, how well it works. We can all speculate on those kind of things. but the one constant that is very reassuring to me is the optimism I am hearing. And so we're blessed at Bridge the Gap that we get to talk to every single week a high level thought leader in the industry. And
Yeah.
the optimism has really, really been encouraging from people that are much more intelligent than me.
Yeah, Josh, if you have a chance, would you mind popping the Bridge the Gap link in the chat? I'd love the audience to, if you're not aware of that website, of that podcast, and if you want to be in tune with what our industry leaders are thinking about, this is probably one of the best resources. So I highly recommend you look into it. Just like what you're saying about optimism is bang on it. I think one thing that the question we were thinking about for our section 3 here, which is the trends for 2021, our predictions. Again, feel free to download our white paper. There's a lot to it where we see things going, which again supports very much what Josh mentioned, which is the timing. We don't really know, but what we do know is that we're all filled with optimism and we all believe that things are going to be improving. When we go back to how do we make 2021 as much as how do we make our predictions come true and as quickly as possible? There's a great framework that I'd love you to consider, which is, go back in time pre-COVID. Right? Go back to yourself in 2019 and let me ask you that question to you in the past, like a year ago. What was the wildest dream you had for you and your department? What was the wildest dream you had for activities and life enrichment? And the reason why I think it's an important question is that the changes we are going through are so disruptive that the dreams that you had in 2019, as we stand today, there's probably not many reasons, and I would argue probably no reason for these to not happen, right? So your dreams of 2019, through the pains and the challenges and the difficulties we had of 2020, I think we are allowed to say that we deserve them, right? We deserve our 2019 dreams. And if that is the case, how do we make that a reality, right? We've talked about most of these things before in the past few minutes in our webinar with Josh, right? We want more budgets, we want interdisciplinary work, we want teamwork, we want more technology. Something we didn't discuss too much, Josh, which is the technology, right, in resident engagement. But how do we make that a reality, right? How do we make that happen? And I think that we deserve our dreams of 2019. Josh, I don't know if you have any comments on this. I don't know if you were tracking the chat as I was talking, but what are your thoughts on that?
Well, it's funny. So when I just try to think of where I was, where our communities and where my small circle of influence was in 2019, it's hard to even imagine how differently we looked at everything in 2019 versus right now. But I mean, Charles, one thing, and this is probably very silly, but I'm a silly person, and people that know me know that. But this is how simple and probably low level some of my goals were as we were looking at some communities that we were taking over management of that were older communities. I remember thinking very specifically and allocating some dollars that I was pinching pennies thinking, gosh, I really just wish my communities could all have strong, good Wi-Fi. It's hard to believe in 2019, I was thinking that about our senior living communities, but I will say an encouraging note, when 2020 hit and everything began to go virtual, how much a priority technology infrastructure became. And it should have been a higher priority all along. And we should have done whatever we needed to make it happen to stay current. But it's amazing until it was a necessity that we did not have money for it, or we didn't make it happen. So, when I start looking at what do I hope for 2021, I hope that our priorities are shaped and that we reprioritize what's really important in our own lives and what's important in our communities. And it's shaped around quality of care and the resident. We get so fixated on all these other frills that really don't make a lot of difference to anyone except our budgets and reports. So that's one thing I'm hopeful for.
Thank you. Yeah, the access to basic, the technology, the Wi-Fi. I don't know if you were looking at the chat, but it's been a lot of that. As we wrap things up, again, as an invitation to the audience, please feel free to consider the white paper that we put together. There's a lot of thoughts, a lot of thinking about some of the things that are actually happening right now. I think ultimately there's one thing, which is what we all want, right? What we all want, and actually this is the wish that we are extending from the Activity Strong platform to you, the audience. What we wish everyone is that 2021 be the year of resident engagement. And personally, to be honest, I don't remember what my 2019 wish was, but I think that if that was my wish back then, I don't know if 2021 would have been if there'd not been COVID, but I 100% believe that we're headed that way. And I am confident basically for two reasons. One, activity and life enrichment professionals have proven to be the most essential workers, the most essential department through this pandemic. And I think that our industry understands it. And I think that the other reason is there's still a lot of opportunities, right? We haven't spoken too much. There's so many cool ideas that we could be talking about, Josh, together. But I think there's something to be said about the potential, the opportunities of this discipline and how much good we can do there.
Absolutely. Charles, thank you for allowing me to hang out with you and these awesome people today. I can't say enough thank you to everyone that's working so diligently and put in so much sacrifice, and blessings and encouragement to you in 2021. I, like you, Charles, I don't even remember what my wish was for 2020, but I'm wishing many blessings for 2021.
Thanks a lot, Josh. So everyone's on the line. Thank you again for showing up. Happy New Year to all of you. May every single crazy wishes you had in the past come true, especially if it comes to collaborating with our residents so they can live with purpose. On the next slide here, we have a contact. Please, and I've said it and I'll say it again, please consider Bridge the Gap and the fantastic leadership and expertise they bring to the industry and the podcast they have. As a reminder, you might, if you were on our last session back in December, we encourage you to consider doing a SWOT analysis, a strength and weakness and opportunities and threats for your department. And we created a template for this, and we strongly recommend that if you have not done this, consider it as you think about your resolutions or your goals or how you want to develop your work, your profession, your department in 2021. We have a huge announcement as a follow-up, is that we, through Activity Strong, are partnering with an organization called Timeslips. And we are going to be presenting to you at no charge a community-based event in Q1, which is happening actually in the coming few weeks, called Shine Your Light. It's going to be a celebration of activities, of creative care, and it's all about supporting you, engaging your residents and your staff. And we're going to kick this off on January 25th during the National Activity Professional Week with NAP. And it's going to go on for 5 weeks throughout the end of February. Megan is posting right now on our chat a sign-up sheet. Please consider putting your details in there, and we will be in touch with all the details. And to kick it off, we have a webinar coming up on January 19th, which is in 2 weeks, with Sammy and Andrew from TimeSlips. They're going to start to help us and guide us through these 5 weeks. With that, I want to encourage you to consider our other upcoming webinars. The executive editions, again, all are welcome. We have the professional edition. This one is going to be with Nancy Ewald of Activity Connection. And as a reminder, we have these major Activity Strong events happening, the Shine Your Light celebration and our virtual summit in June on June 22nd. Josh, thank you. May your wish to you also come true in 2021. And all of you on the line, please remember how important you are. And I, again, on my behalf and on the behalf of my team at Link Senior, I want to wish you everything that you deserve and beyond in 2021. Megan, to you.
Thanks, everyone. We have the CEU survey in the chat box right now. Be sure to fill that out by midnight Eastern time this Thursday, and we'll be sending out the CEU certificates by email on Friday this week. The recording will be made available to all attendees, and you'll be receiving an email shortly with the presentation slide deck and some more information. Thanks for joining us today.
Thanks, everyone.